Hello, this is Dr. Grant Cooper with another office hours where we try to answer your questions. Thank you for the questions. Please keep them coming. This question was, can depression cause sciatica? This is a great question. The idea of somaticizing emotions, that is, somebody is depressed or anxious or stressed, and they start feeling sciatica or knee pain or back pain as a result of just those emotions being suppressed. It's a really interesting question. A long time ago, maybe 20 years ago, I used to host a radio show in New York called Back Pain Radio, and I had on John Sarno. He was a neurologist in New York who wrote The Mind Body Connection, and he popularized the idea that unresolved psychological tension can manifest as back pain, as sciatica. And at the time when he started that thinking, it was novel. It was really important to bring that into the public awareness. Now, with that said, I think that there's a lot of misunderstandings and misconceptions, even about the way that Sarno thought about it. Sarno has since passed away. He helped a lot of people. It's a really important to recognize that there is a connection between the mind and the body. So if I think everyone can resonate with, if you feel stressed, things tend to feel worse. If you don't sleep well, then people tend to, then your back feels worse, then your knees feel worse. Everything's worse when we're stressed, when we're anxious, when we don't sleep. Can that cause it out? Can those kinds of things like stress and anxiety cause back pain, sciatic pain out of thin air, right? When there's no other reason for it? I think the answer is not usually. Like usually, it'll just make things worse. But sometimes certainly it can. There are some people who their back pain really does seem to be unresolved psychological tension that they're just not aware of. Ironically, it's the people that come into me and they say, gosh, I'm really stressed. Do you think that my stress is causing my back pain? That I don't tend to worry about that much. People that tend to be more introspective, people that tend to be aware of the connection between the mind and their body, tend to be, I think, less likely to have their tension be a big part of their back pain or their sciatic types of symptoms. The ones that I really worry about are when someone comes in and I say, "Gosh, Bob, you're going through a divorce, you just got fired. Do you think that maybe all of that stress is contributing in some way to your back pain?" And Bob says, "No, I'm not crazy. What are you talking about? Absolutely not." That kind of disconnect where you're just completely not able to recognize that there even might be a connection between those things, to me starts to say, okay, we really maybe need to be more aware of that, because that might be playing a larger role for that person. There was one guy, um, he was a teacher and he had just gotten fired, and I had seen him off and on for years, and he had back pain and sciatica, and it would come and it would go, and he had a big disc herniation, and everything kind of made sense. And I hadn't seen him for a long time, and he came in with a sciatic flare, and he had just been fired, and he just kind of mentioned that offhand. And I asked him while he was sitting there, "Do you think that, do you think that the sciatic pain is worse now because maybe, because you're just fired and maybe the stress from that, and maybe you're not sleeping?" And it took me by surprise. He started crying right away. He said, and then basically the end of the story is he didn't realize, he said he didn't realize how much it was affecting him. And all of his pain went away. We were actually planning to do an injection because in the past, that's what had helped him. And all of his pain went away when I asked him that question, and he made that connection. And he had this cathartic release of the emotion. So that is perhaps a long-winded way of answering, but I think it's important to be a little nuanced with it, because I think for most people, the answer is in some way. If we're stressed, it tends to make things feel worse. If we're aware of that connection, that's one of the best ways to, ironically, mollify that, right? To make it better. If you just by acknowledging that there might be that connection and trying to be a little introspective and thinking about it tends to make that less of a connection, paradoxically. Whereas when we completely shut down and say, no, 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 I'm stressed, but that has nothing to do with my back pain. I'm not a crazy person. No way. Then you might want to take a beat and think, well, look, there is a connection. There's lots of ways that the neurotransmitters will affect, from the brain to the body and how we perceive things. And so, it's an important thing to think about, to recognize. If you're concerned about it all, I would strongly encourage you to talk to your doctor about it. It's a really important thing to be aware of. And I thank you for the question. I think it's really important. I'll see you in the next one.